Neuro your practice with Quantum Neurology Nerve Rehabilitation Services. This training is for doctors licensed to diagnose and physically treat patients only. My name is Dr. George Gonzalez. I'm the founder of Quantum Neurology, the Holographic Healing series, and I'm the author of the Holographic Healing series. And I'm here to teach everyone about the concept of quantum neurology nervous system rehabilitation. At Quantum Neurology, you will learn how to add a menu of high-value nerve rehabilitation services to your practice, where I share my patented step-by-step strategies of nerve rehabilitation. And even many doctors are currently suffering from injuries, or their family members are suffering from injuries from conditions that are untouched by their best efforts. In quantum neurology, we have a unique approach of evaluating and making corrections to the nervous system. As with any hands-on rehabilitation, there's no promises or guarantees. We cannot predict a future outcome. But what I can promise you is that you will learn the same nerve rehabilitation strategies performed on professional athletes, gold medal winners, and world record holders. The same strategies used on these elite performers are also used on disabled patients. Now, I know not everyone works on elite athletes or disabled patients, but if the same nerve rehabilitation strategies are used on elite athletes and disabled patients, I'm pretty confident that your patient population will fall somewhere in between there and respond to rehabilitation. In quantum neurology, we have specific strategies to rehabilitate from biomechanical faults, lost sensation, cognitive brain function, issues such as vertigo, sexual or sacral nerve dysfunction, maximizing strength through range of motion. We even have strategies for rehabilitation from paralysis. All this is done by exercising and coordinating nerve actions with manual corrections and light therapy stimulation from the GRT light. If you're looking to add high-value nerve rehabilitation services to your patients, follow the links below or stick around, and I'll break down how to neuro-niche your practice with quantum neurology in more detail. Neuro-niche your practice with quantum neurology. Dr. Howard Cohn is a quantum neurology certified practitioner in our 2016 Quantum Neurology Doctor of the Year. He said that quantum neurology is not for everyone, just for those who want amazing results consistently. And if you're like me, that's what I like about the work too. Quantum neurology is a big deal. We teach doctors step-by-step strategies for nerve rehabilitation. Doctors will learn my patented quantum neurology system check, a 28-point whole body sequence neurological evaluation, evaluating every major nerve in the body. This includes all body nerves and head nerves. There are 16 body nerve evaluations and 12 head or cranial nerve evaluations. But more important than learning the proper evaluation and sequence of these tests is the ability to identify the specific stimulus that restores its function when it's weak or inhibited. This means that you'll learn strategies to restore strength, range of motion, lost sensation, cognitive and cranial nerve functions, targeting organ nerve supply, autonomic function, and condition-specific protocols. Most doctors are able to incorporate the quantum neurology essential strategies as soon as they get back in their office. You get started by ordering our Quantum Neurology Essentials DVD and GRT Light package, which includes the DVDs for motor rehabilitation, cranial nerve rehabilitation, and a bonus DVD on the healing form. These DVDs, in conjunction with the GRT Light, provide you with the essential knowledge necessary to get started in quantum neurology and start seeing results the next day in your practice. These strategies are so powerful. I've been teaching these since the year 2000 to doctors around the world. These strategies have been used on the elite athletic performers and disabled people, but most importantly, it's been used on myself, my wife, my child, my family members, and of course, my patients. So to learn more about how to become a quantum neurology certified practitioner and to provide high-value nerve rehabilitation services to your patients, Follow the links below or stay with me as I explain quantum neurology live and online training. Neuro Niche Your Practice with Quantum Neurology, Module 1 training. How does one learn quantum neurology? Quantum neurology is learned in a live and online training events. The principles of nervous system rehabilitation are broken down into 3 different training modules. Module 1 is motor rehabilitation or muscle skeletal rehabilitation. Module 2 is sensation rehabilitation, learning how to restore the sensory part of our nervous system, which is 80% of our nervous system. Module 3 is visceral rehabilitation, learning how to associate neurological functions, neurological tests with organs so that you could provide a way of evaluating organs through the shared nerve supply. You could begin to learn immediately with your private online access. For your travel convenience, modules 1 and 2 are usually taught in one weekend. So be sure to check your schedule and save the dates. Module 1 motor rehabilitation includes the testing of the muscle skeletal system. We evaluate what we call motor rehabilitation, where we quickly examine every major nerve in the spinal cord that's available for testing, and we find the neurological cause of any spinal dysfunction. We also teach cranial nerve inhibition testing. Test and rehabilitate the cranial nerve function. So if you were like me in school, they taught you the basics of doing these evaluations, but they really didn't teach how to correct these tests, these neurological tests. And so you're going to learn how to address some pretty advanced neurological issues just by having a systematic way of evaluating the nervous system. I teach you a step-by-step process to evaluating the motor nerves and the cranial nerves. So they're sequenced. And so it's very easy to see where the patient is, where they're breaking down. And the very most important thing is I teach you strategies for rehabilitating those nerves. So we also teach a concept called G-point, Gonzalez point of interruption. This is based on my patented concepts of neurological system. It's a neurological systems check. This is how to dynamically challenge the body. It allows us to challenge the body as it's used functionally, standing, sitting, moving, performing the actions of your desired sport. All these things allow us to work with you and get advanced corrections on your nervous system. If you have our online training, we have a bonus of arthur-stim techniques. Arthur-stim is an instrument that we use that really is helpful for resetting the proprioception of the body. We teach how to correct biomechanical dysfunction and with the manual and arthur-stim corrections. And we do this with the frozen shoulder technique that I've developed, and this is one of the main bonuses in this section of the online. The other bonus is our heart protocol. This protocol I've found over the years, it's an advanced rehabilitation strategy for Module 3, but I teach it in Module 1 because it's so important. If you come across somebody with the nerve supply, shared nerve supply that's weak, shared nerve supply for the heart is grip strength and abduction of the fingers, opening of the fingers. And so if those shared nerve supplies are weak, we want to go more in depth and evaluate all the different actions that we can associate with shared nerve supply of the heart. When we do this, we strengthen the nervous system so that the body has a stronger ability to resist shifts in the nervous system. So please remember that these are strategies for rehabilitation. And as with any hands-on rehabilitation, there's no promises or guarantees. We cannot predict a future outcome. To learn more on how to become a quantum neurology practitioner and provide high-value nerve rehabilitation services to your patients, follow the links below or stay with me as I continue to explain quantum neurology training. Neuro Niche Your Practice with Quantum Neurology, Module 2 training. If you just joined us, we're discussing the training necessary to learn quantum neurology. Quantum neurology is taught in live and online training events for doctors licensed to diagnose and physically treat patients. And now we're discussing the second of 3 principles of nerve rehabilitation. The first was motor or muscle-skeletal strategies for rehabilitation. In the Module 2 training, we focus on advancing our earlier skills and restoring sensation of the body. Now, sensation of the body is considered to be 80% of the nervous system. Now, I'm not aware of any other system that is able to address the specific corrections of sensation like we do in quantum neurology. So to understand this, first we have to discuss our 5 senses. Our 5 senses create our reality experience. It's the information that comes into our nervous system. This includes our seeing, our hearing, our smelling, our taste, and our touch. Touch is further broken down into pain, temperature, hot and cold, light touch, deep touch, pressure, proprioception, and form recognition. Now in quantum neurology, I teach you strategies to rehabilitate each individual nerve layer. This is a powerful concept that allows you to transform your patients right in front of their own eyes. It's very powerful to be able to isolate the target tissue and be able to individually restore the layers of sensation. And we teach you the strategy for doing that. So in Module 2, the sensory rehabilitation includes advanced motor rehabilitation through GPOI strategies, the Gonzalez point of interruption strategies. And the advanced strategy is called erase. And erase allows you to evaluate people while they're moving. That's really powerful because how often do people say, well, I feel better when I get up off the table or after you've worked on me, but it's when I'm using my arm or it's when I'm moving my body that it's bothering me. Well, in quantum neurology, we have strategies for isolating and identifying the specific point in movement that is associated with causing their issue. And we have strategies of making corrections on those movements. So we evaluate and correct the dynamic movements of the body, and this includes athletic movements or activities of daily living. We also have a concept called GAP, which stands for Gonzalez anchor point testing. And this is where we find the source of the location of the problem in the spine. It's usually in the spine. It can be anywhere in the body, but mostly in the spine. And so this is a strategy where we are able to first clear the issue that the person's having, neurologically speaking, and then we isolate the location where the breakdown of the circuitry happened in the nervous system. And we have strategies for reconnecting or reestablishing that communication so we can strengthen the overall nervous system tone. We also teach intermediate, going back to the sensory testing. We evaluate and treat sensory dysfunction. We address common neurological problems such as numbness and paralysis. These techniques are used with patients who may suffer from a stroke, for example, and lose sensation over part or part of their body or all of their body. These are associated with brain injury patients or patients with MS or autoimmune disease. Now, we're not treating those conditions. We're not treating a stroke or a brain injury or MS or those conditions. We are rehabilitating their nervous system. So it's just like the concept of, well, you don't get cured from being hit by a bus. You don't get treated for being hit by a bus. What we do is we rehabilitate the nervous system after somebody's hit by a bus. And that's the concept we have here. We're rehabilitating the person's nervous system after the damage of stroke, after the damage of brain injury, after the damage of MS or autoimmune conditions. And we have intermediate cranial nerve training in this level where we advance the skills of cranial nerve evaluation. Now remember, the cranial nerves are responsible for your primary reality experience. You're seeing, you're hearing, you're smelling, your taste. And touch is done throughout the body, and that's what we teach in this module as well. But the intermediate cranial nerves are very powerful for teaching doctors how to level up care. We teach protocols on how to address specific conditions of nerve damage that are, they have specific names such as Bell's palsy and different things. And because those conditions have specific nerve weaknesses, we have protocols of rehabilitation for the nerves that have been damaged or inhibited. As a bonus on this online training, we have the breathing protocol, which I teach you how to help people advance their ability to breathe, especially people who have trouble with asthma or other breathing disorders that will prevent them from being able to take a deep breath in or exhaling fully. Those ideas, what we do is we do a reflexive action to re-stimulate the musculature of the rib cage, and that allows for ease of breathing. And we do that in all different body positions, laying down, face up, face down, sides, and so on, standing in different positions, because that's when the body gets compromised. So we're not treating those conditions such as asthma. We are teaching the nervous system how to kick in the reflexes of the musculature it needs to engage to be able to breathe properly. The prerequisites for Module 1 training, the prerequisites for this training is to have purchased the Module 1 online training. Please remember that these strategies are for rehabilitation, and with any hands-on rehabilitation, there's no promises or guarantees. We cannot predict a future outcome, a patient outcome. So to learn more about how to become a quantum neurology practitioner and provide high-value nerve rehabilitation services to your patients, follow the links below or stay with me as I continue to explain quantum neurology training. Neuro-niche your practice with quantum neurology, Module 3 training. If you're just joining us, we're discussing the training necessary to learn quantum neurology nervous system rehabilitation. In our third of the 3 principles of nerve rehabilitation, this is our third of the 3 principles of nerve rehabilitation. The first was motor or musculoskeletal strategies. The second was training focused on restoring sensation of the body. And now we're discussing the visceral rehabilitation, or the organ connectivity of the nervous system. And we teach this in live and online training, and it's only for doctors licensed to diagnose and physically treat patients. In this training, we focus on advancing our skills from the earlier training and then isolating the specific actions of the organs and their shared nerve supply. So what we do is we evaluate the entirety of the nervous system, and preferably, at least for learning purposes, if we get every nerve in the body to be engaged or strong, so to say, then we can add a stimulus to the nervous system, and we can see where the nervous system collapses, potentially collapses. So we call this concept neuroexpression. And the way I explain this is if somebody steps on a nail, their body isn't going to push further into the nail, they're going to reflex out of it. And that's a muscle skeletal reflex, a motor reflex. And the bottom of the foot that gets damaged by that nail, it could be damaged and it could cause sensation loss in the foot because of the damage directly to the bottom of the foot. That's called sensory damage. So far we've spoken about motor damage and sensory damage. And then usually when somebody steps on a nail, they yelp or they scream. Their eyes may bulge, their pupils will dilate. Those are all cranial nerve actions. You're speaking for screaming out, cranial nerve 3 for your cranial nerve 3 and 7 for your pupils opening up, and those kind of ideas. Okay, so that shows how one injury could cause sensory damage, motor damage, cranial nerve damage. But that's not all, because we could also experience chills up and down our spine, profuse sweating, our heart rate may rise. All these things may happen, and these are autonomic actions of the nervous system. And in addition to the autonomic actions, a person, a male, for example, could lose sexual function, or a female could lose sexual function because of the shared nerve supply with the bottom of the foot, S1. S1 innervates the sexual organs, bowel, and bladder. So we can see how one injury to the bottom of the foot, the S1 nerve supply, could lose its sensation locally, The muscle reflex, the muscle communication can be altered because of that injury. The cranial nerve functions can be damaged. The autonomic functions can be damaged, and the sexual functions can be damaged, all from the same injury. And we call this neuroexpression. And in Module 3, we begin to incorporate the concepts of everything we've learned before and explore the neuroexpression of the body. And we're able to stack the neurological actions and begin to make one correction to join all the different layers, the motor, the sensory, the cranial nerve, the visceral, the autonomic functions. So that's a powerful concept that we introduce in the Module 3 training. So when we introduce, when we teach Module 3, the visceral rehabilitation includes concepts called super arrays. And this is where I'm talking about evaluating every layer of the nervous system and being able to join those areas together into a single correction. We have visceral rehabilitation to recover the organ function. And this is a unique method of using the shared nerve supply of the organs. And because if we have the understanding of the full tone of the nervous system when it's in full strength, and we add a stimulus or an action that activates an organ function, we can see where the neuroexpression of the nervous system is. Where does it collapse? A diabetic, for example, would commonly collapse in their hands and in their feet because of the lack of nerve supply due to peripheral neuropathy. It's just a general example as a concept so people can understand that. So when we start looking at these associations with nerve function and shared nerve supply and shared nerve tissue, it becomes a very big concept for understanding how these things work. So when we teach super gap is a concept. We spoke about gap earlier, Gonzalez anchor point. This is super gap. It's a more advanced neurological correction. Super gap was originally our paralysis rehabilitation protocols, but we have since advanced our paralysis rehabilitation with Dr. Chauvin's paralysis points, which are a bonus in the online section of the Module 3 training. We also have as bonuses in the Module 3 training online the dyslexia protocol, or visual processing of information, I should say about that. And we also have topics on traumatic brain injury, rehabilitating traumatic brain injury, paralysis, foot arch reconstruction, TMJ rehabilitation, and much, much more. So the prerequisite for Module 3 training is the Module 1 and 2 online training. Please remember that all these are strategies for rehabilitation. They're not promises or guarantees, and we cannot predict a future patient outcome. To learn more on how to become a certified quantum neurology practitioner and provide high-value nerve rehabilitation services to your patients, follow the links below or stay with me as I continue explaining quantum neurology. So after you've taken modules 1, 2, and 3 and you're interested in learning more, becoming certified in quantum neurology, we ask people to attend 2 live events of each module. So that means 2 live module 1s, 2 live module 2s, 2 live module 3s. And remember, module 1 and 2 are taught in the same weekend, so that is handled more easily that way. We also have a certification course that you will have to attend, and you'll have to submit 10 case studies demonstrating your ability to do the work on your patient population. So the certification is the certification course will be reviewing all the material from modules 1, 2, and 3, and then we'll have a hands-on, I call it a dojo style test. You know, we're going to watch you like a martial arts instructor and student doing the techniques in front of me. I'll be watching you do your work and make sure it's being done properly. There's also going to be a multiple choice test portion as well. And that's how we certify our doctors. We have over 100 certified quantum neurology practitioners around the globe at the moment, and we look forward for you being a new certified quantum neurology practitioner as well. So if you're, as I mentioned, we cannot promise or guarantee outcomes for rehabilitation. These are strategies of rehabilitation that we provide to be able to have nervous system rehabilitation concepts that we teach to people. To learn more how to become a quantum neurology certified practitioner and provide high value rehabilitation services to your patients, follow the links below and stay with me as I continue training, explaining advanced quantum neurology training beyond certification. So after people learn and become certified in quantum neurology, people have the ability to learn advanced training strategies. I consider this to be the black belt training levels of quantum neurology. And this is where I take that neuroexpression concept and we work it through every possibility for the doctors to really grasp and understand how to wield this tool of quantum neurology. Dr. David Pascal, one of our famous practitioners who's worked on his patients, make up over 20% of medal winning athletes in track and field for the US teams in all the major games that come around every 4 years and those kind of events. And he talks about quantum neurology as a Formula One race car. We're handing you the keys to the Formula One race car that allows you to perform amazing rehabilitation on patients and be able to make connections in their nervous system that are not possible in any other way. In Module 4, the Neuro Expression series, it's taught over 4 events. And we teach how to join these concepts together, how to do the neuro expression beginning at the muscle skeletal level. How does the muscle skeletal level neuro express into the cranial nerves, into the sensation of the body, into the organs of the body, and into other areas of the body that we discuss as well. This is very powerful because you learn to take and neuro express everything from the basics of quantum neurology, the muscle skeletal level. The second in the series is the cranial nerve neuro expression. And this is where we take the neuro expression from the cranial nerves and see how does it neuro express into the motor parts of the body, into the cranial nerve parts of the body, into the organs of the body, and so on and so forth. The third part, which is coming up here shortly, we have the sensory part of the nervous system. And this is a real interesting part because there's different concepts that have been introduced into this, but we teach how to restore sensation, but then how to find the neuro expression into the other parts of the body, into the motor, the cranial nerve, the other sensory areas, and the viscera, the organs. And sensory is a powerful, powerful rehabilitation strategy. Again, it's 80% of the nervous system. So if you're learning Module 4 level sensory rehabilitation, you are performing the highest level neurological rehabilitation possible on sensation that I'm aware of. We also have on the 4th level of neurological rehabilitation, for neuro expression, is the organ neuro expression or visceral neuro expression. This is where we teach how to isolate the shared nerve supply of organs and how to find the neuro expression through the motor, the cranial nerve, the sensory, and the visceral actions of the body. These strategies are very powerful, and the doctors that go through this training become the best of the best. And I'm so honored and proud to share these concepts with everybody. This has been a long time in coming. I developed these strategies because my wife had a spinal cord injury, and I developed these strategies to bring her back out of that. They told us that we wouldn't be able to have children. They told us that we should invest in a wheelchair and all sorts of other things. And I couldn't stand for that. So I developed these strategies and I prayed a lot, and these strategies came to me, and now I teach them to doctors around the world like yourself. So please join us. Please join the elite quantum neurology rehabilitation team, and we'll teach you how to do these strategies step by step, how to incorporate them into your practice. And we have other things that could help. We have our Hologram Podcast where I talk about different principles and introduce other thought leaders into this area. We have the Facebook group, our Facebook Explorers group, where you could post questions and other quantum neurology practitioners from around the world could share their experience with you. And we have other concepts and training events too. We have our year-end event, our homecoming event, our Quantum Neurology homecoming event, which is where the doctors come together, the practitioners of quantum neurology, and a select few are able to share their advancements in nervous system rehabilitation. This is a highlight of the year for all of our practitioners, and we always look forward to seeing our practitioners and seeing what they're doing and seeing how they're healing their body and how they're healing their patients. Well, that's it for today. Thank you so much for being with me. It's been very exciting. I don't know if anybody has any questions. I don't see the question box here, but if there are any questions, you could post them and we will make sure to answer them for you. If you have any questions about quantum neurology, go to quantumneurology.com, info@quantumneurology.com for the email, and we'll get back to you there. And I look forward to seeing you at one of our trainings. Thank you very much. God bless you.